Spousal questions are something that I have quite frequently simply because I have clients that I worked with 25 years ago. So many of those doctors are up in age and thinking about transitioning their practice. But one of the questions that I get very frequently from dental spouses is a question that my husband has some health issues. The practice is taking a real toll on him, and I'm concerned about his health. I think he needs to sell the practice now, but he feels that we can't afford it. How can I convince my husband to sell the practice now and not wait? And my advice to this spouse is typically that this is a very serious business decision, and it certainly has to come from the doctor and be his or her decision primarily, but they also have to work with a team of professionals. This team of professionals would include transition experts who know all the ins and outs about selling the practice. This would include your insurance agents, your CPA firm, your financial advisor, and of course, you and your husband. And the second thing that your husband must realize, and I'm sure he already does, is that with minor health issues, they typically escalate over time and with increased or constant stress. So if the health situation is not reversible, it is a much more serious concern than if it were something like a broken leg that could mend. The third thing that you have to do is you have to realize that a true transition actually starts about 5 years before the actual sale. And these are the smoother transitions that are prepping the patients, the doctor, the team members, and giving you enough time to find a successor. The short sales, that is the death of a doctor or a serious accident that disables him or her, is the most difficult transition. And I have the name of 3 wonderful transition experts that I highly recommend to all of my clients. And I think that you have taken the first step in your husband's decision by making this phone call. So please advise him of what we've discussed and let him know that I am here to talk to him and make further recommendations.